And this is a point when, do you remember those, what do they call those, the types of inflammation? The types of hypersensitivity reactions. There's the type 1, type 2, type 3, type 4. Kind of remember that from way back in first year. Type 1 is, I don't know, what do they call it, anaphylaxis. Type 2 is cytotoxic, I think. Type 3 is antigen-antibody deposition. And type 4 is delayed hypersensitivity. Well, turns out that those antigen-antibody complexes that are floating around in type 3 hypersensitivity oftentimes can get laid down in blood vessels. And so when they do, they can affect this uveal tract. And so uveitis is a common eye disease, and it's oftentimes associated with type 3 hypersensitivity type reactions. So I just throw that out so you keep it in mind, because inflammation of this uveal tract, inflammation of anything is called itis, right? So if we have inflammation of the uvea, we might call that uveitis, right? Uveitis. And if we have inflammation of the iris, we might call that iritis. If we have inflammation of the ciliary body, we might call that, we're not going to go with ciliary bodyitis, okay? So, but it's called cyclitis. It's called cyclitis. And if we have inflammation of the choroid, it's called choroiditis, okay? Turns out when there's inflammation of the iris, unless it's superficial trauma, usually that's associated with inflammation of the ciliary body at the same time. So usually when there's inflammation of the iris, it's associated with cyclitis, and so we call that iridocyclitis. So when there's inflammation in the front part of the uvea, in the anterior uvea, the iris and the ciliary body, we call that iridocyclitis. And when there's inflammation in the posterior uvea, that's called choroiditis. Okay? Got it? Iris and ciliary body are the anterior uvea, and the choroid is the posterior uvea. Good. The third layer in, so we've got the connective tissue layer. The connective tissue layer is that tough, just like the orange part of the basketball. It's the tough connective tissue layer that gives the eye its integrity as a globe. And that's in the front. The clear part is the cornea. And in the back, the white part is the sclera. And the junction of the two is the limbus, okay, which is Latin for border, which is where the clear meets the white. And then the next layer in is the vascular layer. The vascular layer is called the uvea, which is Greek for grape, and that has three components. One, the iris, two, the ciliary body, and three, the choroid. And that has a tendency to be involved with inflammation. Okay? The third layer, so we have a connective tissue layer, we have a vascular layer, and then the third layer in is what kind of tissue is the third layer? It's neural tissue. And what's the neural tissue of the eye called? You got it, the retina. The retina. The retina. That's what we see with. That's where the photoreceptors are, and that's where the action is in terms of actually picking up the message and sending it back. And so the retina is the third layer in. And those cells, and the cells, the retina has many layers. It's about 10 layers. We're not going to go through them all right now. But the cell bodies that send all the messages that get perceived back to the brain are the ganglion cells. And then they send those messages back to the brain via the optic nerve. And there's about, give or take, a few 100,000, I don't know. There's about 1.2 million ganglion cells that send their messages back to the brain. Okay? So the 3 layers, once again, I'm belaboring this a little bit, but I want you guys to stick with it. The connective tissue layer, which is the cornea in the front, the sclera in the back, the vascular layer, which is the iris in the front, the ciliary body in the middle, and the choroid in the back, and then the neural layer, which is the retina. Okay? Those are the 3 layers of the eye. Now, we've got some stuff inside the eye too. So, maybe you all recognize what I'm putting in here. This is what? This is the lens, okay? The lens. And it sits right behind the iris. The light enters, goes through the cornea, gets refracted, goes through the pupil, then gets refracted some more by the lens, and gets focused onto the retina. And the lens just isn't sitting there. It's suspended from the ciliary body by these, well, let's call them suspension ligaments, or call them whatever you want. But the name for those is the zonule, the suspensory ligaments of the lens. Okay? So, those are the major structures of the eye. Now, the eye has spaces within it. So, if I were to say, what is the main space, and if I were to draw a line down, and a little squeaky there, down, so that it included the lens and all structures in front of it, what compartment would that be? What space would that be in the eye? Think about that for a minute. The lens and everything in front of it, what space is that? 99 people out of 100 or more will say that that's the anterior chamber. I don't even want to say that, okay? Okay, but that's what that's what people think. That's actually the anterior segment. It's actually the anterior segment. And it doesn't take a rocket scientist to then figure out everything behind that is the posterior segment. Okay? Now you're going to say, well, what's the big deal? And I guess it's not a big deal, except you want to use the right words, right? And you want, when you're talking to somebody, you want to say, well, this is anterior segment disease, this is posterior segment disease. And